What's up guys, Dr. Katie here, back with another one. For those of you who are new here, this is Hey Doc, and on this channel we create important medical content to help you stay in good health and support you in making the right decision when it comes to your health. So if this type of content tickles your fancy, be sure to subscribe, like, share, and don't forget the notification bell. Now, are you always tired? Do you feel tired despite many hours of sleep? Do you easily fall asleep whilst you're driving, whilst you're sat down working, studying? Do you find yourself drifting off to sleep whilst you're reading a paper, reading a book, or just watching TV? Well, you'll be glad to know that you are not alone. According to the CDC statistics in the United States, 15% of women and 10% of men present with the symptoms of feeling tired all the time. If you identify with this symptom that seems to be so common, this is a video for you, so keep watching. According to the British Medical Journal, fatigue can be described as the feeling of malaise, tiredness, and exhaustion that is felt during or after usual physical activities. Or it can also be described as the feeling of not having enough energy to carry out your normal day-to-day activities. But let's not get it wrong. Tiredness has an entirely different meaning according to the British Medical Journal. Tiredness is defined as a feeling of being lethargic without the desire to sleep. However, let's not get confused. According to the British Medical Journal, tiredness has a different definition. It is defined as a feeling of lethargy without the desire for sleep. Now, this is where it gets interesting. If fatigue is due to an underlying medical condition, just getting enough sleep is not going to be enough. So for the rest of this video, I will be discussing with you some of the common medical causes that you must consider may be the cause of your ongoing symptom of fatigue. Obstructive sleep apnea. Have you been told that you snore? Or even that you stop breathing whilst you're asleep? Well, if so, you may well be suffering from obstructive sleep apnea, or known for short as OSA. This is a sleep disorder in which the muscles at the back of your throat fail to keep your airways open as you sleep, causing pauses in your breathing or very shallow breathing. This causes a fall in your oxygen level, which automatically triggers your brain to wake up briefly in order to reopen your airways. These awakening patterns may happen several times per night and lead to a disturbance in your normal sleep pattern. As a result, those who experience obstructive sleep apnea tend to have poor concentration, daytime fatigue, mood swings, and sadly increased risk of accidents, more especially for those who tend to fall asleep as they drive. And finally, as it relates to obstructive sleep apnea, other medical conditions can happen in these patients, such as high blood pressure, chronic headaches, as well as heart disease. Another common cause of feeling tired all the time is anemia, or the loss of blood. Anemia, put simply, is a lack of red blood cells able to carry oxygen around our bodies. As it relates to blood loss, some of the ways that we can lose blood from our bodies include, for women, heavy menstrual cycles, bleeding from somewhere in the gastrointestinal tract, either through the anus or vomiting blood, or some type of undiagnosed internal bleeding. Just as a passing comment, as something that we have addressed in another video on this channel, bleeding from the rectum or the anus can be indicative of some type of sinister pathology, sinister, serious illness that is going on in the lower gastrointestinal tract, often the colon. And so if that is happening, beyond thinking about anemia and the blood loss and the resultant tiredness that you will experience from that blood loss, you must seek the assistance, or you must consult with your doctor to explore and rule out the possibility of serious conditions such as colon cancer. So, coming back to anemia and blood loss. Because we don't have enough red blood cells circulating around our bodies, because we are losing these blood cells one way or another, or we just have not made enough, it means that our blood is not able to carry oxygen in and around our bodies, and so we naturally feel tired. Let's not forget iron, and the fact that iron is a very important component of our red blood cells. And so if you do not have enough iron, either because you're not taking enough through your diet, or you are losing blood from one of the orifices on your body, it will lead to you not having enough blood cells. Other important elements that are essential in ensuring that we have enough hemoglobin, which are the blood cells, to carry oxygen around our bodies include vitamin B12 and folate. A malfunctioning thyroid gland. The thyroid gland is a crucial hormone gland. It plays a crucial role in the metabolism, the development, and the growth of the human body. This gland that is found on the anterior aspect of our neck, when it is underactive, leads to the condition known as hypothyroidism. And this is an extremely common cause of feeling tired all the time. If the heart is not pumping blood around our bodies effectively and adequately, you will feel tired. This is because the blood that is pumped by the heart to go around our bodies carries the oxygen that is crucially needed by all the different organs and the tissues of our bodies. So if you are someone who is feeling tired all the time, be sure to be on the lookout for symptoms of heart failure. And if you are someone who has already sought your doctor about symptoms of feeling tired all the time, and you've had extensive tests and still nothing can be found as to explain why you are feeling tired all the time, have that frank discussion with your doctor, especially if you're a little bit older and you have had pathologies like, or you've had diseases like having had a heart attack in the past, or you've had long-term conditions like chronic obstructive pulmonary disease, which is a lung disease that happens with time in people who have smoked many years. So if you've had these chronic conditions and you've developed a symptom of feeling tired all the time, go back to your doctor and discuss with him or her about getting you investigated or doing the needful to see if you are or have started to develop an element of heart failure. Because when it's managed early, it has a good and promising prognosis. Now, it would almost be considered medically irresponsible to talk about the causes of feeling tired all the time without considering kidney disease. The purpose of the kidney is to filter out toxin, help us balance our excess water and the different electrolytes in our bloods. And so if our kidneys are not working properly, those toxins will build up in our bloodstream, and they will lead to us feeling fatigue and short of breath. Kidney disease will lead to the buildup of fluid in our bodies, leading to swelling and weight gain. The buildup of fluid that happens in patients who have kidney disease does not just happen in their legs and in their peripheries, but most importantly, it also happens in the lungs. So these patients feel short of breath and have difficulty breathing. This is particularly the case when they try to sleep at night and they try to lay flat. And these patients are therefore unable to have restful night sleeps and contributing to them feeling tired all the time. Many patients who have kidney disease will also suffer from sleep disturbance because of frequent urination and or restless leg syndrome. Several rheumatological conditions such as lupus, fibromyalgia, sarcoidosis, to name but a few, are often forgotten when we consider causes of feeling tired all the time. This is because these conditions are not the most common causes of feeling tired all the time. In fact, they tend to be symptoms that manifest quite late into the diagnosis of these rheumatological conditions. So when all other causes have been ruled out, be sure to mention to your doctor whether some of these rheumatological conditions should be explored. They will tend to manifest though with other symptoms such as joint aches and pains, swelling of the joints, and various other symptoms. Medications are another cause of feeling tired all the time. Some groups of these medications include benzodiazepine, some pain medications such as codeine, morphine, and other strong opioids, also tramadol. Some antidepressants will also cause you to feel tired all the time. High levels of blood sugar that manifest in patients with diabetes can lead to frequent urination, which ultimately can lead to the patient being dehydrated. And so if a patient is dehydrated and doesn't have enough circulating volume, they will feel tired all the time. Diabetes can also cause sleep disturbances such as sleep apnea, nocturia, that's frequent urination at night, and restless leg syndrome. All of these can cause sleep to be disturbed and the patient to wake up frequently at night, and in the morning they become tired because they've had unrefreshed sleep. Most of us lead very, very busy lives, and stress can be a very normal part of our life. The source of our stress can range from stress at work all the way through to our home, day-to-day family life. And this stress, particularly when it's frequent and consistent, can affect the neurotransmitters in our brain, which will affect our normal circadian rhythm, which is the natural substance that our body releases to allow us to fall asleep, to have that natural pattern of sleep at night. And so therefore, do not underestimate stress in causing you to feel tired all the time. There you have it, guys. Common medical reasons why you might be feeling tired all the time. And so if I've mentioned anything that you have not thought of before, or you have seen your doctor before and have had some investigations about why you might be feeling tired all the time, there's some elements I've mentioned here your doctor has not necessarily considered. It's important that you go back to your own doctor for another consult and bring out some of the points that I may have mentioned here that you may not have considered or your doctor has not investigated you for. If you have been feeling tired all the time and this has dragged on for some period of time, have you tried medication? Have you tried any therapy? Have you done particular exercise regimen that has helped you? This is a community where we all share our medical experience or our experience as it relates to some health issues that we have had, so that others can learn from what you've done, from what your doctor has investigated you for, so that another person can also benefit from doing the same. So if you have found this video helpful, remember to subscribe, like, share. Don't forget the notification bell. I'll see you in our next video. Take care.